In a few minutes, a day-long conversation begins about the state of healthcare in Texas. Our partner, the Texas Tribune, is hosting the meeting at the Houston-Tillotson University. And joining us from there is Texas Tribune publisher Evan Smith. Good morning, Evan.
Good morning. How are you?
Thank you. Very well. Well, you are
Good.
moderating a discussion with the chairwoman of the House Public Health Committee and then the chairman of the Senate Health and Human Services Committee. And there's a proposal to kind of combine the state's 5 health agencies into one agency. But why is that needed and how is that even progressing?
Well, you know, we're always looking to reform our healthcare system. Healthcare has become a very expensive line item in the state of Texas. It's always been expensive to some degree, but education has usually been the thing we spend the most money on. Healthcare is now rising faster than education and is soon going to be the most expensive line item. We've got to figure out how to get a handle on costs, and consolidating the health agencies may be one way to do it.
Well, then, of course, some are worried about the impending shortage of doctors in the state.
Right.
So why is it a concern and what sort of solutions are being proposed?
Well, as you know, we're adding 1,000 people to the state's population a day each of the last 2 years, and Texas has declined to be part of the Affordable Care Act in the way that some other blue and red states have. And so we really have a situation in which health reform and that conversation about adding new doctors and adding more coverage has kind of been pushed to the side this session. One thing I'm looking forward to today is to hear what has been going on during the session, but also to acknowledge what has not been going on. We have to get a big handle on this problem. Healthcare is not the top priority in the legislative session so far. We'll have to see what happens.
Yeah, so how do you wind up making it a top priority then?
Well, I think you have to get to a crisis before people are willing to acknowledge that there's work that needs to be done. And I'm afraid that roads and guns, higher education, border security, these things took top spots on the agenda this time. It'd be nice if there were more discussion of health care, but there's always work that can be done outside the 140 days. We're getting down to the wire. It's probably a little late to expect health care to rise to the top right now.
But do you think those are topics because their constituents are wanting to hear about that, or that it's really needed?
Well, I think politics. Now, from a political standpoint, those are the things that voters are talking about, so those are the things that legislators are talking about.
Makes sense. All right, Evan Smith, the publisher of the Texas Tribune, we always appreciate your insight. Thanks so much.
Thank you very much. All right.
And we want to mention the event is already underway with a free breakfast followed by the discussions at 8:30. It's free and everyone is invited. You do have to RSVP to attend, and we have a link where you can do that on KXAN.com.